On today's episode of Vulnerable Populations in California, Team A1 is going to take you through the city of Boyle Heights.
Boyle Heights is located approximately 1 mile east of downtown Los Angeles, and it is composed of 6.52 square miles. It is among the oldest communities in Los Angeles and was developed as one of the city's first residential suburbs. Boyle Heights is a historically rich neighborhood. Approximately 100,000 residents live in Boyle Heights. Of these residents, 95% are Latinos. That's 15,000 people per square mile, among the highest densities for the city of Los Angeles and among the highest densities for the county. The barrio has a mean annual income of $35,000, which is less than the median annual income of $60,000 across the entire United States. As fascinating as Boyle Heights is to me, it is a low-income neighborhood that has limited access to quality, healthy food. The residents live in an underserved community with no access or options to nutritious foods and are at risk for obesity. There is an overabundance of fast food. Let's put it this way. According to the Los Angeles County Department of Public Health, there are over 167 liquor stores, corner stores, and convenience stores, all whom which accept food stamps. Combine those corner stores and the overabundance of fast food places in the neighborhood, junk food establishments are over 200 in the 6.52 square mile border. Boyle Heights only has a few full-service grocery markets. Adolescents are experiencing ethnic health disparities such as obesity. Obesity has increased in adolescents in the United States and within Boyle Heights. In Boyle Heights, 50% of adolescents are overweight or obese, compared to the 34% in Los Angeles County and the 29% statewide.
95% of the population in Boyle Heights are of Hispanic descent. Our targeted population, Hispanic adolescents, make up 13.1% of the Latino residents in Boyle Heights. Hispanic cultural influences, such as food-related beliefs, preferences, and lifestyle behaviors, can be attributed to the increasing rate of teen obesity in ethnic minority populations such as the one in Boyle Heights. Boyle Heights has an annual median income level of $35,000, which is almost 50% less than the annual median income of residents across the United States. Boyle Heights is considered one of the low-income neighborhoods of Los Angeles County with a poverty rate of 33%. Statistical data shows that a majority of the Boyle Heights population is uneducated with no high school diploma. According to the U.S. Census Bureau, 55.2% of the population has no high school diploma, 33.6% has a high school diploma, and only 11.2% has attained a higher degree of education. Together, these two socioeconomic concerns have a major influence on the high teen obesity rates in Boyle Heights. Due to cultural and socioeconomic factors, our vulnerable population is at an increased risk for teen obesity. Under these circumstances, it is likely that adolescents can fall into unhealthy lifestyle patterns such as lack of physical activity and poor nutrition. These lifestyle patterns can pose psychosocial concerns to our population, such as the effects of bullying, depression, low self-esteem, or weight bias. These psychosocial concerns are important to consider because they can drastically affect the way they manage their weight.
Access to affordable, fresh, healthy food is a major barrier for this population. Most of the population does not know how to read food labels. Overweight or obese and diabetes are much higher for the Latino and African American populations than the rest of Los Angeles County. In addition, about 190,000 students district-wide in LAUSD schools are eating breakfast at school daily, and 450,000 are not. Only 29% of students are coming in to eat breakfast. Children who don't eat enough are less focused on school, which results in lower academic performance. Soda or sweetened drink consumption 2 or more a day is a concern. Fast food consumption 3 to 4 times a week and little to no physical activity contribute to health concerns for this population. It's important to teach adolescents about nutritional facts so they make better food choices. Teaching about healthy eating choices that can be implemented in their daily diet and make healthier choices at school is a priority. Reducing soda consumption, increasing health literacy, and increasing healthy food consumption are goals for this population as well. A bi-weekly Latinx pop-up event, Veganos and Islos, sells vegan food, desserts, and drinks in Boyle Heights Mariachi Plaza. Weekly events can be organized by vendors to bring awareness about vegan choices and provide healthier food options to the Boyle Heights community. In their 5-year history, the Wellness Center, located in Boyle Heights, has provided life-changing resources to 25,000 community members who have participated in support groups, cooking workshops, exercise classes, and signed up for health insurance.
What is public health nurse? Care is provided within the context of preventing disease, disability, promoting and protecting the health of the community as a whole. Public health nurse is population focused, which means that the population is the center of interest for the public health nurse. What is the role of public health nurse to adolescents 12 to 17-year-old at Boyle Heights? They serve as educator, advocator, planner, data collector, counselor, and they do health status monitor. Educator is a public health nurse provides education about the importance of good nutrition. Being an advocator, they supports or recommends healthy meal options. As a planner, they organize activities for community health promotion and prevention. Data collector to assess and evaluate the issue of adolescence at Boyle Heights, data collection is involved. As a counselor, they focus on ensuring the delivery of quality care. Doing the health status monitor, they will monitor the health trends and identify health risk factors. Lack of nutrition was the main issue we found at Boyle Heights. What are the core functions of public health nurse and how does it apply to the adolescents at Boyle Heights? Assessment, policy development, and assurance are the 3 core functions of public health nurse. Let's talk about assessment. Assessment monitor health status to identify and solve community environment health problems. They diagnose and investigate health problems and health hazards in the community. After research and investigation, we found that the biggest health problem adolescents currently facing is lack of nutrition. In terms of policy development, they inform, educate, and empower people about health issues. They mobilize community partnerships and actions to identify and solve health problems. And they also develop policies and plans that support individual and community health efforts. Public health nurse would organize a community teaching activities around the area of Boyle Heights, which targets adolescents who are experiencing lack of nutrition. The last core functions of public health nurse that we need to talk about is assurance. Assurance enforces laws and regulation that protect health and ensure safety. Link people that needed health services and assure the provision of health services when otherwise unavailable. Assure competent public and personal health care workforce. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. And research for new insights in innovative solutions to health problems. Besides organizing community teaching, public health nurse new innovative solutions to help adolescents at Boyle Heights, such as providing pamphlets to take home for further study and guidance, promote change by explaining the risk factors that come with lack of nutrition, provide technical assistance by training school staff how to buy fruits and vegetables, or by simply teaching the adolescent to prepare healthy meals.
The 3 local agencies delivering services to Boyle Heights are: number 1, Alliance for Healthier Generation. The agency has made it easier for more than 50,000 youths in 454 out-of-school time programs to eat right and move more. Part of their work is to reduce calorie consumption along with the country's three largest soda manufacturers. Each beverage company is committed to focus its effort at the community level and specifically in communities where there has been less interest in options that help community members reduce their calorie intake. The neighborhood of Boyle Heights is one of the first communities to see those changes, with a measured decrease in beverage calorie consumption per person in 2016 to 2017. Adventist Health White Memorial. Healthy food build strong communities. Lack of access to exercise and fresh produce is contributing to diabetes and obesity epidemic in Los Angeles. Adventist White Memorial is working to change that by providing space and support for a unique community garden in Boyle Heights by creating a space where families can grow their own food organically, free of cost, and participate in healthy gardening and exercise classes. Number three, Health Corps. Health Corps is an American non-profit organization that provides school-based and organizational health education and peer mentoring in addition to community outreach to underserved populations. Students learn life-saving skills in nutrition, fitness, and mental resilience. Additional resources needed in the community are: number one, Supplemental Nutrition Assistance Program, SNAP. 2. Alliance for a Better Community, ABC. 3. Latino Coalition for a Healthy California, LCHC. 4. Community or Edible Gardens. 5. Urban Strategies.